Melanie Potock, and I'm a pediatric speech language pathologist in Colorado. And I specialize in helping all kids from, birth up to age 17 learn to love food. And a lot of times those kids have medical issues that are getting in the way of them learning to eat. And other times it's really just they've learned to be extreme picky eaters, perhaps due to anxiety, perhaps due to an incident when they were younger. I certainly have had kids on my caseload who had trouble eating because of a choking incident as a toddler. There's a lot of different reasons that we could list about why kids become more hesitant eaters. But where it always starts when they first come to us, speech language pathologist, occupational therapist, etc., is we need to get in their mouth. We need to take a good look inside their mouth and make sure that there's nothing structural getting in the way of them learning to become adventurous eaters. And if you want to know how to do that, I want to tell you that on my YouTube channel, and I'll post that here in just a little bit tonight, I'll put a video right up here for you so that you can see how to do a really good oral mech exam using the throat scope and what sorts of things you're going to be looking for, whether you're looking for speech issues or feeding issues. Structural issues is really what we're thinking about. Okay, but tonight we're going to talk about 5 fun ways to use the throat scope in feeding therapy. And I want to I'm going to briefly show you on myself a few things, and then I've got a little friend here to help me. So bear with me for a second because it's hard to talk and demonstrate with this at the same time. But what we're going to be talking about today is taking a look at tongue lateralization. Watch, you guys. My tongue can move to the left and right, and it moves right over to my light up throat scope. We're also going to be talking about tongue elevation. Look. And tongue elevation also includes the mid blade back here and squishing the whole tongue up into the roof of your mouth. And then likewise, we're talking about lip closure. And lip closure can mean just lip closure in this way, but it also means enough lip closure that you build enough intraoral pressure to really propel food back. So I want to show you a couple tips around that. So I have to mention something. On the throat scope blade, and by the way, if you're not familiar with this, these blades, they come 50 to a box and they're recyclable. So you're going to just use one per patient, per client, because you're going to have plenty in the box and obviously they're sterile. But take a look right here. I'm going to kind of move you over to my black sweater. Do you see that little line right there? Do you see that? That's exactly 1.25 inches past the tip. And I use that line all the time when I'm doing an exam because it provides a nice reference point for how far back I might want to put the blade, but also where to place food on the blade to help a child lateralize, elevate, and close their lips. So let me show you what that means. Where I typically start is, look at that, you guys. That's just a little O-shaped cereal, and I've got it stuck to my blade with a tiny bit of cream cheese. Now, you could certainly use, peanut butter, sunflower butter. You could, if you wanted to have a little bit of sugar as a special treat, you could use a little bit of cake frosting if you wanted. It's such a tiny amount that it's minimal in this process. But here I have just some O-shaped cereal, and what I'm going to do is light it up, and I would be placing the blade exactly, see how that's 1.25 inches back, exactly up to the point where the line meets with the child's cheek right here, right where their lips come together in a smile. Now, if you're working with a baby, obviously you're going to adjust because they have smaller mouths. But most kids, I take that line, that mark, and I go right to the point where the kid is smiling. Let me show you what I mean. I happen to have brought a little friend here tonight because because he's got a great, wonderful mouth here that really lights up so that you can see super well. So what I do is when I'm trying to get a child to work on tongue lateralization is I take a little O-shaped cereal and I simply put the lightsaber or the fairy wand or the throat scope into the cheek itself. And now the child moves their tongue toward the cereal and they can either touch it or if they want, they can grab it and munch it down. So you can do that on both sides. You can also use the exact same thing. See how well it sticks? It's so great when you're working on tongue elevation. So go ahead and put your blade or your lightsaber right up to the point where you want the child to elevate their tongue. In this case, I've put the little piece of cereal right at the tip of the alveolar ridge. We call that our spot, and we'll be talking more about that in a minute. And then they're going to elevate their tongue up to that spot and either grab the Cheerio and munch it down or simply just touch it. I love O-shaped cereal like this because it makes a nice target for the kids. I want to give you a couple ideas around this same concept before we move on to the next exercise. Now, the reason why I choose a O-shaped cereal is because it's easily meltable. I can do it for children who are just getting started on solids. It's not a safety risk. You really want to think about that. Another option for you is, guess what this is? It is simply a little slice of a meltable like a Cheeto or Pirate Booty. I know in Israel, they have very similar snacks like this that are made out of peanut butter powder. There's veggie sticks. We can all think of a million of them. I just slice them into little tiny pieces. See that? And attach them to the throat scope blade. And that's something else that we can use that's a little bit meltable. Now, both of these are extremely mild flavors, so great for little kids who can't tolerate a lot of punch. We call it a lot of punch of flavor. But let me show you another alternative. While we certainly want to keep sugar to a minimum, sometimes we got to make it fun. And even just one little flavored cereal, like this little green one, or you've seen the variety of colors, that can add a little bit of extra punch for sure. Now, for your older kids who can manage something that they have to chew a few times before it melts, like a chocolate chip, you can attach a chocolate chip there. If you want to work on precision, attach a mini chocolate chip. That works great. Now, why would we care about precision? I mean, isn't it just a matter of moving your tongue from the left to the right? Yes, but you have to remember that a lot of the kids that we're working with, they make very gross movements, very broad movements in their mouth. And when we're trying to help them have better control of that fine motor movement, actually adding something a little bit smaller helps them zero in on it and be more precise in their movement. That precision is so important because you and I, we can easily find, oh gosh, a little piece of food up in our molar and go right over there. We can grab it and safely swallow it if we need to, spit it out if we needed to, etc. But many of our children, they'll get food stuck on the roof of their mouth or in their teeth or up here in the lateral sulci, and they don't have the precision to get up there and grab it. And that's a safety issue. So think about the size of the food that you're going to put on the blade. I happen to have a rather large chocolate chip here, but go ahead and go smaller if you want to work on precision. Just remember to choose a food that's safe for every child. Now, here's another thought too, when you're thinking about precision. This happens to be a little chocolate chip that also has just a tiny bit of candy on top. You've seen these before. They sometimes come in the bakery shop and we put them on top of cakes, or you might even find them packaged in the candy aisle. They're just little sprinkles attached to a chocolate chip, but what they do is they provide a little bit more texture, a little bit more input. Again, remember though, you want it to be a couple chews and melt right away. That's one of the beauties of chocolate. So we've been talking about how to use our throat scope to not only work on tongue lateralization, but we're also going to be talking about how to work on tongue elevation. Before I do, though, I want to give you one last tip around the lateralization piece. When you put your throat scope in the child's mouth, watch, and you're trying to get the tongue to go over, and you have a little piece of food there to really tempt it to go over, here's another tip. You can either go in and tap to provide additional input, or you could use a vibrating tool just to provide a little bit of vibration so the kids know to move their tongue over there. Children have a reflex when they're, oh gosh, in that first year of life especially, we're really going to see it, where the tongue will move towards stimulation. But many of the children that we're working with, they don't respond to that reflex as well as we'd like them to. So by providing that extra input on the outside, either tapping or maybe even a little bit of vibration with your finger or with a tool, gives them that extra input that will help them be successful. So let's get back to tongue tip elevation. I want to show you something I did with one of my other little puppets. I'm sure we have a lot of speech therapists listening tonight, and I think a lot of us have this puppet. But as you notice, it's a mouth. And when you open it, this is what I want you to pay attention to. Do you see that little black spot up there? I actually used a marker and I drew that myself. That's what we call your spot, where you want the tip of your tongue to go to the alveolar ridge when you are going to swallow some food. So children who don't know how to elevate the tip up to the spot, we typically are able to see kids do that after 1 year of age, maybe 14 months at the latest. But for the kids who aren't able to do that, it's really important that we help them understand where that spot is. So one way that I do that is I use my puppet and I actually color in that spot right there. But then what I'll do is take my throat scope once again, and I'll put something on the tip of my throat scope that really has a lot of punch. In this case, what I've got here are the brand name here in the United States are called Pop Rocks, but they are essentially little crystals that when you put them in your mouth and they mix with saliva, there's a little bit of gas in there and they'll actually pop in your mouth. Yeah. So I love those to really call attention to that spot. And what I do is I put my lightsaber on, and I simply put it right inside the child's mouth, right here. Remember, we talked about this line, so you're going to use that line. And oh my goodness, just putting my tongue tip up there, it's popping on the tip of my tongue. Sure enough, I've hit my spot. So you can do anything like this. You know, you could use cake sprinkles if you wanted. You could use a really tart candy that's a powdered candy. I'm sure we've all seen these before. You could use something like the brand Pop Rocks if you'd like to. You know what else I use? Lemonade powder. So any sort of drink mix that just comes in a powdered form, especially lemonade or limeade drink mix, you only need a smidge of that. It's barely any sugar at all. It's just enough to let the kids feel where their tongue needs to go. Let me show you another tip around that. This one's one of my favorites. Okay, my friends, do you know what this is? It's a pill holder, a vitamin holder. And I'm sure you've seen they come in long ones. They come in, I love the circular ones, but each lid opens up, which is great. But can you tell what I have in here? I've got cake sprinkles. I've got more of the candy that I just showed you that pops in your mouth. I've got some lemonade powder right here. And what I let the kids do is I let them turn it and open up one, and then I'll show you. Okay, there's some powder, right? Actually, that is strawberry powder from Strawberry Drink Mix. And all I'm going to do is just put a tiny bit of cream cheese. Look, not very much at all. Again, you can use anything that'll provide some stick. And I just let the kids dip it. Isn't that fun? And they can just dip it, and then we'll use that for the next exercise. And then I close the lid, and we open up the next one, and we get to use the next taste for an exercise. So just a fun way to really work on oral motor skills, but also keep the kids interested without adding a lot of sugar. Okie doke. So we've been talking about lateralization. We've been talking about tongue elevation. I want you to keep in mind that tongue elevation also includes the more central blade of the tongue. Let me show you where, right here. See how far back I went? I personally call that your tic tac spot, or where you might throw a mint in your mouth and you would hold it right in the cup of your tongue. That part of your tongue needs to elevate into the roof of your mouth when you have that mature swallow pattern that we were just talking about. So at about 12 to 14 months of age, and it improves over time, but roughly in that window, kids should start to be able to swallow with the tongue tip to the spot that we just talked about, and then squish the rest of their tongue up into the roof of their mouth. Watch. Just like that. When you want kids to work on being to elevate that mid blade of the tongue, one thing you can do is also take your throat scope, light it up, and go ahead and remember, go all the way back to that line and take it in a little farther back, rest it on their top teeth. And have them press right up onto whatever you put on the end. Sure enough, I've got some of those tart candies right in the center of my tongue. That's what we're aiming for. That's what we're aiming for. So again, that's one of those where you want to pick something that has a little bit of punch, like lemonade powder, etc., so the kids can really tell where that taste is landing. It's right in the center of their tongue. Okay, we've talked about lateralization. We've talked about two types of elevation. Let's talk about lip closure. Lip closure. When it comes to lip closure, I'm going to do the exact same thing. I simply took a little bit. I want you guys to be able to see that, so I'm going to put it right here in front of my black sweater. I want you to see that I put a little bit of cream cheese. You could use frosting, sun butter, whatever. And I've just added, in this case, I've used a little bit of chocolate powder, like that you'd make hot chocolate with. Minimal sugar. It's probably, I don't even think you can measure it. It's so minimal, like it's a pinch. And I've just dipped it in there, and I'm going to light it up. And then what the child is going to do is, when they go to close their mouth on it, they simply take off the powder itself. So watch, you can either present this way for lip closure, or you can put the powder here and work on lip closure this way. When you're working on this from a lateral presentation, make sure that you pay attention to what's happening with the tongue. Watch my tongue. Did I just push it out with my tongue? We don't want to do that. What we want the kids to learn to do is keep their tongue in their mouth and use their lips independently from their tongue, or dissociate that from the tongue. So it would look more like that. Okay, so we've got a lot of different ways to use tart powders, to use just really just a smidge of candy every once in a while, just to keep the kids interested, but keep the sugar down. And then also we've talked about how to use meltables, O-shaped cereals, little slices of meltables like the Cheeto brand Cheeto Puff, or perhaps, veggie sticks, something like that. We've talked about a lot of different things to do, but the most important thing is to always keep it fun, because when you pull out something that lights up, it's automatically fun, and then you can keep changing it up depending on the presentation or what you let the child dip into. And then finally, I have one last tip for you. Somebody who was observing me the other day said, well, I was doing the same technique in feeding therapy, and they were saying, well, how do you get that little bit of peanut butter or that little bit of cream cheese or frosting or whatever it happens to be on there? Let me show you how minimal it is. There's barely any on there. Can you see that? What I do is I go to the dollar store And I wash these really, really well, but I just get some little paint brushes and I simply dip it in the cream cheese. And then I just paint a smidge right there. Or you could, you could certainly use, oh my goodness, you could use even a heavier toothpick or the back of a spoon, but I think this is kind of fun. And I let the kids do it too. And then we just pop our food right on there and we are good to go. We are good to go. Look at that. Isn't that fun?